Week. There are so many accomplishments from our teachers and students to celebrate, and I have never been prouder to work in service of Arizona's public schools. This school year has presented many challenges, but schools have met each moment with careful consideration for the safety and well-being of students and staff. In particular, our teachers have gone above and beyond to support students through some of the most difficult moments of this year. I'm grateful for the superintendents, school board members, and educators who compassionately led their communities. Today, we are joined by one of those leaders, Elena Aguilar, president of the Osborne School District Governing Board. I also want to thank our healthcare professionals who have served our communities tirelessly throughout this crisis. Among them is Dr. Jason Vargas, president of the Arizona chapter of the American Academy of Pediatrics, who also joins us today. And I'm here today to continue offering the support of the Arizona Department of Education. I'm offering our support and expertise to schools as they expand or plan for in-person learning. Safely resuming in-person learning has been a priority over the last year as our public schools have navigated COVID-19. As of this month, nearly 60% of our state's public schools report offering either hybrid or in-person learning, with many more schools making plans to resume in-person instruction for the fourth quarter. The new CDC guidance highlights how in-person learning is possible when done safely with consistent and transparent mitigation strategies in place. The key pieces of their guidance points to the importance of wearing a mask, social distancing, and prioritizing in-person learning and academics over other school-sponsored events like sports. Mitigation strategies have been proven to work. Our schools have key tools and policies that make learning safe, including a statewide mask mandate for schools. In some cases, schools have utilized creative strategies to enforce social distancing despite Arizona's high class sizes. Furthermore, school professionals currently have greater access to the vaccine than other workforce populations. When mitigation strategies are layered and enforced, growing research shows that schools, particularly those serving elementary grades, can effectively limit in-school transmission. For this reason, the ability to enforce and layer mitigation strategies is an important local factor for schools to consider. With COVID-19 infections and transmission decreasing, now is the time for rebuilding and regaining the trust of our families, teachers, and students. This work will be particularly critical for our hardest hit communities, which disproportionately include Latino, Black, and Indigenous students and families. Our students have had a wide range of experiences within the pandemic, and for some, returning to the classroom will be joyful and a return to a sense of stability. For others, especially our students who have seen friends and loved ones become sick or even lose their lives to this virus, it will be a more anxious experience. And we must first build the trust to ensure that these students and families feel comfortable and safe transitioning back to the in-person classroom. Acknowledging the varied impact of COVID and the trauma endured means that in-person learning is going to look and feel different in every community. And that's okay. Local context matters. As our superintendents and governing boards are tasked with difficult decisions, I recognize that some school communities need more time to plan and prepare. I want to support schools at every stage so that when they do resume in-person learning, they are doing so safely with mitigation strategies in place, enforced, and with the support of their families, students, and teachers. To that end, the department recently announced allocations from the second federal COVID relief bill. These one-time recovery funds will be critical to helping schools implement mitigation strategies like hand washing stations, improved ventilation, and cleaning. Additionally, the department used discretionary funds to ensure that all nonprofit schools receive federal funding regardless of their size or location. This decision is critical to supporting our small, rural, and remote schools, which are far too often left behind when resources are allocated. Wherever possible, ADE will work to provide our schools, particularly elementary schools, the resources and supports to resume or continue offering in-person learning. And for those schools and communities who are not ready to resume in-person learning, we stand ready to offer the supports and tools necessary to offer high-quality learning while providing resources to recover from the trauma of the pandemic. Finally, I want to encourage everyone who is eligible to get the COVID-19 vaccine. It adds another critical layer of protection against the virus. Most importantly, the COVID-19 vaccine is safe to get. More information about the vaccine, including where to register, is available through the Arizona Department of Health Services or your county health departments. Next, Dr. Vargas, president of the Arizona chapter of the American Academy of Pediatrics, will speak to the science behind the CDC recommendations and the importance of in-person education. He will then be followed by Elena Aguilar.
Good afternoon. I want to first thank Superintendent Hoffman and the Department of Education for inviting me here today, for inviting our organization here today. It's a pleasure. My name is Jason Vargas. I'm a local pediatrician, but I'm also the state chapter, Arizona chapter, president of the American Academy of Pediatrics. We represent over 1,100 pediatric providers throughout the state, and our mission is to advocate for the health and well-being of children and their families. Schools and school-supported programs are fundamental to child and adolescent development and well-being. They do not only provide academic instruction, but also help our children develop social and emotional skills and provide critical support services that benefit their physical and their mental health. These support services may include access to reliable nutrition, counseling, and opportunities for physical activity, among other benefits. Because of COVID-19 pandemic, most of Arizona's children have had to continue their education virtually during the past year, at least at some point. They have missed the opportunity to interact with their peers and have access to opportunities for socialization as well as school-based mental, physical, and nutritional health services. We know that children and adolescents have shouldered a disproportionate burden to keep our community safe over the last year. Unfortunately, the educational and mental health cost is likely to most negatively affect the most vulnerable. The COVID-19 pandemic and periods of distance learning have been especially difficult for children who are English learners, children with disabilities, children living in poverty, and children who are Black, Hispanic, Latino, and American Indian. These families especially may rely on schools to provide a safe, stimulating space for children to learn, opportunities for socialization, and access to school-based mental, physical, and nutritional health services. For children and adolescents in virtual learning models, educational disparities are widening, especially for Black and Hispanic Latino students, as well as those living in poverty. According to the Pew Research Center, 1 in 5 teenagers are not able to complete schoolwork at home because of a lack of a computer or internet connection. This digital divide, of course, also affects those most vulnerable, disproportionately affecting those Black, Latino, and Indigenous families living here in Arizona and those living in poverty. We know that here in Arizona, there are many children that have not been able to return to in-person learning, and many communities have had to contend with poor lack of access to internet and digital devices when considering remote learning. Now, With more experience and scientific evidence, we now know that children are not the main source of community transmission of this virus. Fortunately, children have also been largely spared the most severe consequences of COVID-19 infection. Experience has also demonstrated that schools can operate in person safely here in Arizona. But to do this effectively, we need to adopt mitigation strategies suggested by the CDC and supported by Superintendent Hoffman and the Department of Education, particularly including masking, physical distancing, frequent hand washing, respiratory hygiene, and contact tracing efforts. We need to put our children first. Schools should be the last place we consider closing, and the first to reopen should closings occur. We know that child-to-child transmission spread is not the cause of community transmission. It simply mirrors what's going on in the community. Because of that, and to keep our schools open, we must do our best to decrease community spread. We all have a shared responsibility to ensure there's as little disease as possible in the community when we do send our children back to school. We also support the wide availability of vaccines for our teachers and school workers to keep them safe working with our students. We know that those who have had the option of returning to in-person school may have some apprehension about safety. For children without significant health problems and with proper mitigation strategies, the risk is relatively low. Because many parents are concerned about MISC, multi-system inflammatory syndrome in children, I'll speak a little bit about that right now. It is a condition where different parts of the body and organs become severely inflamed. Now, we don't know the exact mechanism for this, but we do know that the kids who get this either have been exposed to COVID-19 or have gotten COVID-19 themselves. The overwhelming majority of these children, however, who have had this MISC recover with minimal treatment. The most recent data from the CDC suggests that there's been slightly over 2,000 cases in the US and 30 deaths. Fortunately, when put in the context of other childhood illnesses and other consequences of COVID-19, this consequence of this syndrome with the consequence of this disease is pretty rare. We urge you, however, to discuss your family's specific situation and your child's baseline health with your own doctor if you have any concerns with regards to sending your child back to school. Arizona's children need to return physically to school, and it can be done safely. It is where critical academic, social, and emotional services are delivered. It is where our children grow and thrive socially. It is where we recognize those that need help before it is too late. We support the risk mitigation efforts needed to get children back into their school buildings. And for those who cannot return to in-person learning, we support a robust effort to ensure that all the resources are there to help children learn online. We support those efforts to decrease community viral infection with vaccination and risk mitigation efforts. Together as a community, along with the help of schools, administrators, school and state and local governments, we can ensure that the children do not continue to shoulder this overwhelming burden unnecessary. We encourage aggressive funding to ensure safety and the future of our children. Thank you very much.
Am I that little?
We don't want to tell you that.
Good afternoon, buenas tardes, para los que no hablan inglés. My name is Elena Delgado. I'm the board president of the Osborne School District. I am here, first of all, I want to thank Superintendent Hoffman and the Department of Education for inviting us today, for inviting me today to represent my incredible community. I also want to thank my superintendent, my staff, and my community that includes parents and other community members for the amazing work that we have done together for the reopening of schools. Osborne staff reports on site back on Monday, March 15th, and the Osborne students will report in person on March 30th, 60% in person and 40% virtual through iSchool. We will not be teaching in a simultaneous mode. We conducted a survey and we were very lucky that 90% of our staff responded to the survey, and we've been very lucky that we've had up to 90% of our staff vaccinated, and with time we're looking at 95% of all staff being vaccinated. We're very lucky because of where we are located and because of the access and collaboration between the other 13 school district plus Phoenix Union High School District superintendent. We've been able to work and partner up and have had access to multiple vaccination opportunities, which we know is not the case for other school districts in other areas, specifically rural areas. We are ready to open. Our mitigation strategies for a safe reopening include correct mask wearing for all students and employees, physical distancing. Our students will have plexiglass in between. We'll ensure the cleaning and proper ventilation, which our bond that we passed allowed us to update our HVAC ventilation process, air exchange, and all systems are brand new. We've been paying attention to the dashboard and following indicators of community transmission to reflect level of community risk. We also, in the beginning of the pandemic, created a health committee because, as you may already know, most school board members are not public health experts. So we've been relying on our health committee as well. We've partnered up with Maricopa County Hospital, Valle del Sol, and State Representative Tony Navarrete, Senator Navarrete, who provided COVID-19 testing in the beginning of the pandemic. We've had multiple vaccination opportunities for all staff. We continue to have them as well. We partnered with Phoenix Union High School District and Maricopa County Health for pods for all staff vaccination opportunities. We know that inequities still continue to exist. Teachers and district staff in rural and other areas other than Maricopa County continue to lack access to vaccinations. We know that we continue to have the lack of access to technology, and we know that Latino families have been disproportionately affected by the pandemic, and that, is going to set us further apart from all of the other communities. So we, as the Osborne School District, have looked at the opportunities. The opportunities for school districts that have benefited us are to look at the local context. School districts need to make the appropriate decisions in order to keep their communities safe. In order to reopen schools or keep schools open, it's imperative that all positive cases of COVID-19 for staff and students are reported to schools or that they get tested when exposed. It takes community effort to manage or maintain the safety of our schools. I know how fortunate the Osborne School District is to have had multiple opportunities to access the vaccine, but that is not the case for every district. If you have not personally been impacted by the effects of COVID-19, consider yourself fortunate because our largest, most vulnerable population has been impacted. Thank you very much. Muchas gracias.
Superintendents, including some in Southern Arizona, that they feel a bit of pressure to get kids back in the classroom before testing begins. What do you say to those districts who might be feeling that way?
Well, I definitely think, as I mentioned in my remarks, that local context really matters. And I have also heard directly from school leaders, teachers, and parents about the concerns that they have for testing, for assessments and in-person testing. I think it's important to be clear that there is not an option to do online state assessments. Even though the test is computer-based, it is not an online test. So it's not as easy as flipping a switch to make these tests available in the home. Other issues to be thinking about is when we're talking about state assessments, one thing I want us to keep in mind is a question we're all asking, which is how are our children doing? How are our kids? Especially after a year of this pandemic, and for us to have targeted supports and services, including special education services or English language services, it's really critical to know how our kids are doing. So we are doing everything we can to work with the federal government to have maximum flexibilities. We've reduced the test length, we've expanded the testing window, and we strongly encourage our school leaders, especially at the school building level, our principals, to be working directly with teachers and families to do everything within their power to make the testing environment as safe as possible.
Jason?
With so many kids doing virtual learning on and off for the past year, how much concern is there about the fact that many may have fallen behind and not necessarily gotten what they need out of this? How big a concern is it, and what steps can be taken to try and help some of them catch up either in the spring or in the summer to make sure that they're ready for the next grade?
I have significant concerns about the impact of this year of disrupted learning, especially for our students who've been most impacted by the digital divide. Students who have not had access to the technology or internet at home are those who are most likely to have missed out on having access to a high quality learning environment. In terms of what we can do to help students get caught up, and I kind of hate using that word because it's not our students' fault that this year has been so disrupted for them, but we're working to get targeted supports to the schools that need it the most by looking at which communities have been most impacted by COVID-19. So for example, partnering with the governor's office on the acceleration academies to get targeted supports and resources, and that can look different for different schools. It can mean more tutoring services, it can mean extended school days, it could mean more reading specialists and math specialists. Also, we're providing a lot of guidance to our schools on how to use their federal COVID relief and recovery dollars, which are very flexible and can also be used for additional academic supports. So there's a lot of flexibility in how that can be used depending on the needs of the community.
Right here. Do you have a timeline or time frame for schools to get for schools to go back in person, or do you personally advocate a certain time frame of when schools should start to go back?
So one thing we have learned from the beginning of the pandemic is to not put a date on it because, again, local context really matters and using that local data. And so in terms of when schools will be back in person, just to give an example, Navajo Nation in our schools up in the northeastern part of the state, I've heard loud and clear from them that they do not expect a return to in-person this school year. And that's the local context that really matters. They have been devastated by the impact of COVID-19 in terms of the number of lives that have been lost and the fear from their families and parents about sending their children into the school building. And so there will be different parts of the state who are more ready for in-person instruction than other parts of the state, and we have to understand the cultural and local context and how that can look different in different parts of the state. So again, we're doing everything we can to provide districts with the supports, districts and charters with the supports and resources that they need to be moving, if they're not already in person, to be moving towards in person. But we know there's some districts, some governing boards that have already made that very difficult decision that they want to continue to have stability, and there's the fatigue from going back and forth between different instructional models. So I think it's really important to support our governing boards in making these difficult decisions.
Rocio?
What advice do you have for school districts that have these large class sizes? What are some strategies that they can do to ensure the physical distancing? And on the COVID guidance that the CDC released, is any of that required for Arizona schools? And if not, why?
So start with the CDC guidance. It's guidance, and this is, again, where local context matters, and we do have, that is an important factor for our schools to be considering in thinking about the logistics when they're planning for in-person instruction is thinking about their classroom sizes, and that can be a factor for why some schools may make the decision to continue with hybrid options, or having a couple days of a week in school, a couple days a week from distance or virtual learning. And so that's one creative way that they may be addressing that, is by not having 5 days a week of in-person learning. Other strategies I've seen are, when possible, offering outdoor learning spaces, using larger spaces like cafeterias and gyms where possible, to use all the space possible within a school building. But I do think we all need to be very aware that Arizona continues to have a severe teacher shortage, which results in higher classroom sizes, and there will be schools and classrooms where 6 feet is not possible, and then making sure we're really taking that seriously.
Right here. Right here. So the school's COVID-19 dashboard for Maricopa County still shows that there's substantial spread of COVID-19 in the community in a lot of school districts. Should schools continue to follow those guidelines, or should they, also consider what the CDC is advising? What should they do?
That's a very good question, because at this point there are multiple factors that schools can be considering to inform their decisions. And so I think what has changed over the past month, and why even my language around this is shifting, is because our educators and school staff, by and large, more and more of them have had access to the vaccine. And so by making sure that we're addressing the fact that within our school communities, it can actually be safer in the school than out in the community, because a greater percentage of the school communities have had access to vaccines. Again, that's not uniform for the whole state, for every district. So again, that local context will really matter. And I think for Arizona, it's really important to follow the CDC guidance that we're prioritizing elementary schools, because all the research and data has suggested that there's much lower in-school transmission for our younger students, from student to student and student to teacher. So I also think that the data I urge our school leaders to be paying attention to is how many positive cases are in the school, and working with the local county health to determine if that constitutes an outbreak, which would require additional actions such as quarantine or other measures.
Josh?
Another thing that the CDC suggested is that schools have the opportunity for testing for the virus. Have you had any conversations with state and county health or the governor's office about testing availability for different school districts?
We have. So the Arizona Department of Health Services partnered with ASU, and it was roughly 15 or so school districts to do a pilot program to offer on-site testing for educators. And the preliminary data that was shared with me was that there was actually very low participation in these programs. So I think, now that we're roughly a year into this pandemic, testing is more widely available for those who want it. There are many places where people can go to receive a COVID test, and so by offering it at the school might not necessarily increase the participation of people in getting a COVID test.
Last call. Go back to Danielle for one more.
I actually have a question for Dr. Vargas. I know we talked a lot about kids and the benefits of them being in school, and safety components with that. I know your expertise is in pediatrics, but for teachers or staff members, adults in these classrooms who might be concerned, can you offer any words of advice or information?
Well, Danielle, the evidence has shown really that if we layer all these mitigation efforts like we should, and with the CDC guidelines and hand washing and masking and respiratory hygiene, etc., that the risk actually in the schools could actually be lower than in the community. Now that we have widespread availability at some point at least for vaccinations for teachers here in Arizona, I think that combined with that layer approach, teachers can start to feel comfortable about getting in. Now, every teacher has their own health issues, and certainly it would be their own decision to really discuss with their own physician. But when you're making it safer at school and doing everything you can and putting all our efforts in there first, when you're vaccinating the teachers and giving them that responsibility, one might ask, what can you do outside the school to make yourself safe? And I think if we focus and put all our efforts there, I think for a teacher who's relatively healthy, who wants to get vaccinated, and the school has a proper funds to use and layer all those mitigation efforts in place, I think it can be safe for them as well.
Last call. Oh, Nicole, I'm sorry.
This is a question for Elena about
There you go. Just want to be able to hear you.
Osborne's reopening after being virtual since the beginning of the school year. What was the conversation about? I guess what compelled the governing board to want to open now, even? And is there a concern that with rising numbers that the classrooms are shut down?
We've been virtual, and the reason that we are planning the reopening is because we have had access to the vaccination, and hopefully we're up to 90% of our entire staff has been vaccinated. So at 95% before 2 weeks prior to reopening, which is on March 15th, that's the date that all staff would report. Up to 95% of all of our employees would be vaccinated, so that makes us feel comfortable with reopening because we have had that access to the vaccination, and our employees have taken up that opportunity.
And what about the fluctuations in the positive percent positive?
Well,
that
we have seen the numbers decrease, and we are considering that. Of course, we're still paying attention. Tomorrow's Thursday to the benchmarks, but we are taking proper mitigation processes that we are going to ensure that we continue to mask up, that we have plexiglass, that we have the proper ventilation. We already have done an analysis of that our students, are, that they have safe spaces where they can take off the mask, where our families have a safe place to pick up and drop off their children, where even their lunch opportunities are planned and where they can take those opportunities. So we have a mitigation plan and process that makes us feel comfortable with the reopening of our schools. Thank you.
Last one right here.
this question is for Kathy Hoffman.
It's difficult to say the extent by which academic supports will be needed, but in terms of the mental health supports that our students need right now, that is very critical at this time. Last night I met with my student advisory council, and the main topic was actually about technology in our schools, but even within those conversations, our students told me about some of the mental health concerns that they had, and one of them had the idea of even creating support peer-to-peer groups online because her school is still virtual, but she's noticing that the students need a safe space to connect with each other. So I absolutely think, one of the things we've been advocating for from the state legislature this year is to fully fund the school safety grant program, which we expanded last year by $20 million, but there's still an additional $45 million needed to fully fund all the requests from our schools to be able to hire more school counselors and social workers.
So it's still a little too early to know about how many will require summer school?
So actually, in order to truly know how our students are doing in terms of academic is by using assessments, and this is where we're, of course, having a lot of challenges and where it's causing a lot of stress to our, especially, having been a teacher, I can completely relate to the fact when you know your students have had a disrupted year of learning, and I think we can also all relate to the feeling of taking a test when we haven't had access to learning all the material on the test can cause a lot of fear and anxiety for the teacher and for the student, and then also, of course, the parents and families. So to truly know how our students are doing academically is for them to do testing, but we're working through what that will look like, and of course, trying to do that in a safe a way as possible. But that's why that data is important, to make sure that we can make those types of decisions on which students need summer school, how much academic support do they need additional supports and services. That's why that data is really important.
All right, I think we're going to wrap it up for today. Thank you all so much for being with us. And if you have any follow-ups for any of the speakers, including the superintendent, please feel free to reach out to me and I can connect you to either one of them if appropriate. Thank you all so much.
Thank you all.